Healthcare open enrollment is going on right now. You really need to look at what plans are offered to get the most bang for your buck and make sure that you're being covered in the way that you think you should be. Consumers for Quality Care board member Jason Resendez is joining us to break down what you need to know about healthcare and open enrollment and some pitfalls to watch out for as well. He is answering your questions too, so we want you to text your questions to him at the number 336-379-5775. Remember, these are text-only questions. These are not call questions. We want to make sure that you know for sure that you're texting in these questions and you'll get your answer in real time. All right, so Jason, let's first and foremost go over kind of like the basic thing. Let's just go over the open enrollment dates and the deadlines.
Sure. So it's important to know that right now open enrollment is open. Keep in mind a couple of deadlines. One, December 15th is a deadline for you to have coverage through the marketplace starting January 1st. And January 15th is a deadline if you want coverage starting February 1st. Really important to know these enrollment periods. Really critical because this is the time that you have to really think about what options are best for you and for your family, and what might be either staying with your plan if that's a good fit or making a change given all the changes that are happening right now due to the pandemic.
All right, so let's talk about some of those changes. And first and foremost, let's talk about how COVID has changed health insurance. I know last year, lots of things COVID related were covered by insurance, but I'm understanding that this year there are some changes. So what do we need to know?
Yeah, so a lot of things are changing right now. As you know, we're still in the midst of a global pandemic, but unfortunately we're seeing scaling back of insurance coverage of things like copays related to hospital stays due to COVID-19, even testing related to COVID-19, treatment related to COVID-19. So I think that's really critical, especially with the rise of variants. You know, we're all still very much at risk for COVID, even in light of vaccinations. So understanding what your insurer covers related to COVID is really critical. And you can find that out by calling your insurer and asking about whether or not they still have waivers in place related to COVID. That's especially important if you're in a profession with the high risk of developing COVID, you're in a high risk situation. So that's really critical. The other is related to telehealth coverage. So we've all come, I think, to rely on telehealth. Certainly a survey that we did found that 70% of consumers said they want to continue to use telehealth services even beyond the pandemic. It's really helped to extend access to coverage in light of the pandemic and just make accessing healthcare more convenient for consumers. Yet we're seeing insurers start to roll back, for example, waiving copays related to the use of telehealth services. So this is another important change to be aware of. If you come to rely on telehealth, or that's something that you prefer, like many consumers, it's important to understand whether or not your insurer is still waiving copays for utilizing that service. If you receive your insurance through Medicare, for example, it's likely those waivers are still in place. We've seen those be maintained during the pandemic. It's really through private plans that we're seeing a scale back of those services. So again, the same kind of advice: call your insurer and ask about whether or not waivers are still in place to cover telehealth services free of a copay.
Okay, and those are specific questions to ask. All right, let's move on to surprise billing. So there's been a lot of talk about how surprise billing is going to maybe one day go by the wayside. We have heard all of those horror stories of people going to the doctor thinking that they're covered with everything, then they get this bill in the mail that they did not expect.
That's right. I mean, these are horror stories that have really been at the forefront of a lot of media coverage. And because of that increased impact and increased visibility, Congress stepped in and passed surprise billing legislation that'll help curb the impact of surprise bills, but that doesn't start until 2022. And so until then, it's important to understand as much as you can where you'll receive care. So if you're planning, a procedure, et cetera, really it's important to understand right now that all the care that you're receiving is within your network. What we've seen are a lot of instances of folks who go to an in-network provider, but maybe while they're there, they get seen by an out-of-network provider. So for example, an anesthesiologist is part of a procedure. While the hospital was in network, maybe that one provider was out of network, and that results in a big surprise bill. So as much as you can, ask questions and understand whether or not the care you'll be receiving is within network. Now, that's not always possible, especially if you're in an emergency situation. So what we recommend is if you get a surprise bill, really push back, ask questions, ask why this is so much higher, both to the hospital and to your insurer. And if you're persistent, what we've seen in a lot of cases is that bills will either be reduced or waived altogether because of your advocacy as a consumer and your willingness to continue to push back against these high bills. But thankfully, starting in 2022, that burden will be taken off of the shoulder of you as a consumer and put between the hospital and the insurer to figure out, or the provider and the insurer to negotiate who's going to pay that bill as a result of a surprise.
Okay, and so that can be a frustrating experience, having to go round and round with your insurance provider in the hospital, but it is worth doing that, especially if you're getting any of those bills up until the end of this year. We're going to take a quick break. When we come back, we're taking your questions. We're also going to answer what is a junk plan and why you need to be wary of it.